Today I discuss exercise as medicine for both physical health and mental health conditions. And I'm joined by Dr. Shah, a family medicine specialist, a certified nutrigenomics practitioner, an exercise as medicine's credentialed professional, but most importantly, a fellow cyclist and endurance athlete. So I consulted Dr. Shah when I had my genetic tests done, and it helped me understand my health risk markers that I inherited. And Dr. Shah also helped me to understand why I'm genetically suited for certain sports and physical activities and how to optimize my performance. So do contact Dr. Shah if you want to have your genetic profile done. So, Dr. Shah, let's start by talking about what are the key insights that someone can get from genetic profiling.
Sure. Nice to see you again.
Yeah, absolutely.
There's a lot of things actually you can gain from doing your genetic profiling. One of the most important things is your propensity to develop certain diseases. By doing your genetic profiling, we can tell you whether you're more at risk of developing diseases such as heart diseases, hypertension, diabetes, to say the least. Now, the interesting thing about this is that you can actually not change, but alter these genes to a certain degree to make it favorable for you. So, gone were the days where you think that your genes is it all and end all. You know, that's what you have, and there's nothing you can do with regards to it. But actually, there's a lot of things that can be done to your genes. You can switch it on, you can switch it off. Okay, and the ultimate aim is trying to reduce your risk of developing all these diseases.
I guess that's the study of epigenetics.
Exactly, yes. Exactly.
So how lifestyles can switch on or switch off certain genes.
Exactly, yes.
And actually, one of the things that I read, which was quite fascinating, was the twins study.
Yeah.
So can you tell us a little bit more about that?
Yeah. So when you get identical twins, they're supposed to be born with identical genes. So genetically, they have the same chromosome, the same DNA. So the interesting thing was there was a study that they took two children at a young age, 2 years old, 3 years old. They were quite similar, but when they reach 50 years old, they are quite different, simply because they marry different people. They're exposed to different things, so they become two different individuals. Whereas the fact is, they still have the same core genes as twins. So that clearly shows that there is something that you can do to make these genes express differently.
Sure. And so let's talk about exercise as medicine, because clearly exercise and physical activity affects our physical health.
A lot of studies has been done into exercise, and gone were the days where a general exercise advice has been given to everybody. So I think everybody is different. Everybody needs exercise differently, and this is where exercise prescription comes in. So basically, there are 4 categories of exercise that you need to look into. We acronym it as FIT, F-I-T-T.
F-I-T-T.
So the first one is frequency.
Frequency.
So everybody should have 5 times a week of exercise. And the second one, the I, is intensity. It has to be of certain intensity. And then the third one is time. It's advised you have 30 minutes of exercise each time. And what type of exercise is the last T? It can be aerobic, anaerobic, and also other types of exercise.
So, Doc, now that we know exercise has to be personalized to each individual's condition based on the FITT model, what about someone who's wrestling with conditions like diabetes or heart diseases? What types of exercise would work for them?
Again, you need to really understand the patient as a whole. There's not only one particular condition, in the sense that you really need to know their background in terms of how used they are to exercise and so forth. So different diseases really have a different prescription for exercise. For example, if you're diabetic, your exercise mainly is focused on reducing sugar. Right? So that would probably be more aerobic, but they need to have strength to build up their muscles. As opposed to people with hypertension or heart diseases, they might need to be a bit more cardio related. It is still aerobic, but the intensity
is higher.
Because you want that heart rate to be a bit higher than what you would use to say to lose weight.
Right.
As such. So hence, that's why different conditions should really have different prescriptions of exercise.
Okay.
So I think it's a bit difficult in Malaysia.
Sure.
I think not a lot of people still have that knowledge to know what type of exercise to do at what
Sure.
condition.
But they can always consult you.
Oh, definitely, yeah.
Absolutely.
No problem.
So finally, I guess, even for conditions like depression and anxiety, how does exercise help us with our mental health?
There's a lot of studies saying that there's a lot of release of endorphins when you exercise, feel-good hormones, so that increases as well. So yep, that's again a very valid point. Also very interesting, they say, is when you exercise, not only your blood vessels in your heart dilates, your blood vessels in the brain dilates as well.
Right.
So you have less chance to have what we call small infarcts in your brain. So this reduces your chances of getting Alzheimer's, dementia, and stuff like that. But also on the other side of the coin, people don't really see this as a benefit. Is that most people, when they exercise, they do it in a group.
Right.
So the social interaction itself
Right.
actually is very, very, very advantageous.
Absolutely.
In terms of your mental health. You know yourself, we go right in a group.
Yes.
You know what I mean? This,
Absolutely.
you know, you get this camaraderie, it lifts up your spirits. And also sometimes we have people who have targets.
Yep.
Yeah, they achieve, I want to run the Standard Chartered marathon, and they use this as a motivation.
Right.
And this generally brings them up from a certain position, and all this together I think helps mental health. But I think, for me personally, I think from all the reading I've done, is that I think the most important aspect is, I think, the social.
Absolutely.
The social bit actually will help a lot in terms
And
of...
right now, does being a Liverpool supporter help with your mental health?
Definitely.
Awesome.
There's no question about it.
No question. There you have it. Dr. Shah, a hardcore Liverpool supporter. You're going to be a very happy person by the end of the season.
Yeah, I'm going there.
Wonderful.
Yeah.
Great. All right, guys. So thank you very much for joining us. And as usual, let's keep things positively personal.